Back to you.
Jonathan, thank you very much. Now, this headline in the Los Angeles Times today: chaos at hospitals due to a shortage of coronavirus tests. How serious is this? With me now, Dr. Anita Gupta. Dr. Gupta, thanks for joining us.
Thank you very much.
These headlines have been part of the issue from the very beginning, and it's sort of shocking to a lot of people that they persist. What's going on?
Well, look, first of all, the United States is a global leader in public health. And, the net effect of everything that's going on with the coronavirus is that, we have the capacity to address this. We have the resources, and we need to be that public health leader. And I believe the White House, the CDC, has all the resources to address this, and we can get there. What is important is that the United States public needs to be reassured right now, needs to understand the data. And I think that's where we need to be. The question really comes out on what are the resources that we have? What are the screening measures? What is the availability of testing? And I think that's really what we need to understand as a public health citizen, as someone that understands the gravity of illness and disease.
Well, and to that point, when 2-3 weeks ago, we heard from administration officials, Peter Navarro, that there was a boatload of masks and other equipment on its way to America from China. Of course, they had their own issues, so they turned the boat around. I mean, is this also a cautionary tale for us to start to produce some of these things at home, so when we have these issues, we're not relying on the rest of the world?
Well, look, there is such an important question here on testing, right? And you're raising a very important question. When we start developing things too quickly, we have to look at the safety and efficacy and the quality. We want people and the communities that we live to really have the best available type of testing that's reliable, that's specific, that is sensitive enough to detect disease. And, first of all, there are many tests that are potentially out there, but are they accurate? Are they going to be reliable? So, the last thing we want is a test to be false positive or false negative. So due diligence is so important. And I'm sure that the American public wants that to occur, as I would, as anybody would. So time and due diligence is always so important when we try to address public health emergencies. And I'm sure that's going to be part of the conversation today.
When we see videos in South Korea of folks driving up and getting tests as they sit in their car, they're getting the coronavirus test. I mean, again, I'm sure it begs the question, the accuracy of it, but by the same token, people are wondering why the preeminent healthcare system in the world, the #1 country in the world, we're seeing headlines in these places where they don't have the proper equipment, the proper testing equipment. And by the way, how long will it take? Apparently, the administration said that there would be enough tests at the end of this week to provide another 400,000 tests and a lot more next week. So do you feel we're catching up to this?
Right. Look, I know that the FDA put out, loosened the requirements to do further testing, but there are other agencies involved. Everybody has the capacity to address this, and those are the conversations that are occurring, and we are waiting to hear what that looks like. And I know scientists are working very hard around the country and around the world really to address this as vigorously as they can. And again, I can't emphasize the United States is the global leader in public health, and we will get there. But what is so important is that we reassure the American people that, we are doing everything that we can, that I know in our community of physicians, that there is so much work being done, but it is so important to advocate for prevention, that people and people are cautious out there right now.
Dr. Gupta, thank you very much. Meanwhile, folks, the White House considering some targeted stimulus